Hi, Dr. Paul. If you're not on my social media, please join me on Instagram and TikTok. And we do post a couple posts a week. They're about 90 seconds each. But we've been covering some ground there and I'm hearing with the comments I'm hearing. I wanted to address some issues that people get confused about. So one of the things that people say is that there's withdrawal effects, that these are terrible medications because when you try to go off of them, they have withdrawal effects. So what does that mean? So if someone's on a medication, let's say an SNRI, my number one. So we got serotonin balance and we got norepinephrine balance. Great. So now we've got these chemicals going the right way. Good. So let's say someone's doing well. Let's say other than that, they're on Wellbutrin, they're on whatever. And so let's say they're doing great. The mood is better, the depression is better, the anxiety is better, everything's great. So what happens when people take away medications too early? Well, I mean, everything that's going this way starts to go that way. So what it means is that they're just not taking long enough. So when people are complaining withdrawal, the question back is, well, why are you going off of them? And the typical answer is going to be, I don't want to be on these long term. I don't think they're good for me. I read on Dr. Google that this and that. So a lot of people get their information from friends and family, Google, whatever, chat rooms, and they ignore my advice and they go by other advice. And they get upset because, well, why can't I get off of these? I want to go off of these. Well, it depends on the person because, if let's say the body does not balance these on their own, and let's say you take it away and all of a sudden everything goes the wrong way, it's not addiction to these medications. It's not what's going on. It just means that they shouldn't be stopped. And people get bothered by that. They think, well, I want to stop. Now, again, if someone really wants to stop and I can't talk them out of it, what's an easy way of doing it? I put them on an SSRI Prozac. Now, why Prozac? Because it's an SSRI that has a long half-life. And what that means is when you put it in, it lasts for a few days and doesn't, so some of the shorter acting medications, if you don't take them for a day or two, you might notice it because they're out of your system quickly. So if someone is just really upset that I have to, okay, I'll get you off them, stop the medication, put you on Prozac for a couple of weeks, stop the Prozac, and that'll take away these we call withdrawal effects, where they feel like I feel like I did before I started, or why am I feeling worse than before I started? Well, you're feeling worse before you started because now you finally have the chemicals going the right way, and just with that going to the crashing, because before they were always going the wrong way all the time, and so you didn't really. But when you see the benefit and then you take it away, that's why the withdrawal happens. And so all it simply means is when you see it is that you shouldn't be stopping them. Or maybe you don't like them, so we try something else, But that's and how long, we'll talk in another video about how long that these should be taken. But this withdrawal thing bothers a lot of people I've seen. I've seen a lot of people complain about SSRIs because of the side effects. So what are the typical side effects? Apathy, feeling flat, feeling apathetic, sexual side effects, numbing, like I said, numbing effect. So what does that mean? If someone has really good results but has side effects, well, that's simple. I just put some Wellbutrin in the mix, and then all of a sudden when we get dopamine moving, then that takes away the side effects. Now, the other main thing it could mean is that, okay, well, let's try switching from an SSRI to an SNRI, so we're balancing both and not just one. So once we get complete here, then hopefully, and when people are feeling really good, hopefully eventually they get to the point where just let it be and just take them, because they're safe, they're effective, they're not addictive in any way. And people will say, well, how are they not addictive? Because when I stop taking them, I feel like I'm addicted. I have to restart them again. I go, well, that's not addiction. It just means they stop working. In the very way, and I explain examples, like if someone just decides I'm going to stop my diabetes medication and then the blood sugar shoots through the roof, and they're saying, well, what happened? I go, well, why did you stop that? Well, because my blood sugar was so normal. I said, well, maybe it's normal because you're taking that, right? oh, well, I never thought of that. I thought it was just my diet was better. I said, well, no, because you have diabetes. It's a chronic condition. You're going to have it the rest of your life. I'm sorry, but that's the truth. Blood pressure, cholesterol, thyroid. I can go down the list of things that people who have these conditions take the medications. They don't even question it. They never ask their doctor. Well, they might say, well, how long do I have to take this cholesterol med? Well, how long do you want your cholesterol to be normal and safer so your heart? Well, I guess I want to. Okay, well, why don't you stay on that one? See, people have no problem staying on supplements and vitamins long term. They don't even think about it. When it comes to these, people think about it. And so, anyway, that's hopefully that answers the question of why withdrawal. Why does it happen? It happens because of this. It happens because if you don't get the chemistry moving correctly, your body will tell you. Your body is going to tell you that something's wrong, but when we get everything correct and everything balanced correctly, hopefully most of my patients get to the point where they're happy where they're at, and they have no reason to stop them, and because there's no problem with them. So anyway, most of these are safe with pregnancy. They're safe with breastfeeding. They're safe long term, so really they're extremely safe medications. No, they don't cause liver and kidney problems. No, they don't cause long term side effect issues. No, they don't, there's certain medications we do monitor blood levels like lithium and Depakote, but for the most part, there's no reason to check laboratories even because they're that safe. So anyway, that's the issue. Hopefully that explains things a bit.